Hi, everybody. Welcome back to another episode of Decoding the Health Matrix. I'm Dr. Yiachos, Dr. Gio, and once again, I'm trying to bring whatever works out there to make a difference in the way people feel. And it's crazy to me. I constantly search how many people are suffering with inflammatory conditions, how many people have chronic autoimmune diseases, and the numbers are so crazy. And it's become clear to me that people don't understand, even science does not understand how much of what we suffer has to do with a chronic inflammatory condition. So if you go and search online and you say, how many people suffer with chronic autoimmune disease, it's going to tell you, oh, 1 million people, and it's mostly females. And then you go on to say, well, how many people suffer from inflammatory conditions? And they're going to tell you that it's 110 million people. And if you go online and you Google how many people have a chronic illness, not inflammatory, not chronic autoimmune, they're going to tell you 150 million people. And the reality is that 15 million people that they're telling you are suffering from chronic autoimmune conditions. A, it's an old number. B, it is such a small subset of how many people are suffering from their own body attacking itself for a variety of reasons. And since the COVID era, that's increased tremendously. And very clearly in practice, we have plenty of people coming in that have long-haul COVID symptoms, have had vaccine injuries that are causing a lot of problems. And lo and behold, you're checking their blood work and they're chronically inflamed. And so I'm always out there looking for tools that we can use to get people feeling better. And that's why I harp so much on platelet infusions, on ozone therapies, on supplementation, making sure your gut's okay. All these things are very, very important. But it's really amazing to me how many technologies have been out there since the 1800s and have made a difference. And it's only now that they're being rediscovered. And of course, they're not being talked about because there's no money to be made from the big pharma perspective. So you have to rely on people that are in the integrative realm to find these things. And recently I had the pleasure of visiting a practice in Idaho Falls run by Kim Look and by Christina Finnerty. And it was all about IV Procaine. And it's been talked about for a long time. And it is amazing what is known about Procaine. It is amazing what can be done with Procaine. And so I want to introduce you all to Kim and to Christina. And I hope that we could investigate this a little bit further and see what role it could play in helping our patients. If you guys can come online, that would be great. There you go. There's Christina. Hi, Christina. How are you? And hi, Kim. How are you?
Hello, I'm doing great.
That's awesome.
Hello.
So we had a great weekend when I came out there. It was amazing to see what you guys do. And just the terminology, talking about the kinds of things you could do with Procaine was just fascinating to me, and what you call them. I don't know, Kim, maybe you could chime in a little bit. I'm going to start with you, Kim. If you could tell me a little bit historically why Procaine is something that can be used in this realm and how it's gotten to this point, that would be great. So what is Procaine? What does it do?
So Procaine is Novocaine. It is an anesthesia, or was originally an anesthesia, but it doesn't work very long in the body, and yet it also processes. Part of the reason why it doesn't work very long as an anesthesia is because it processes differently than most other anesthesia, making it very, very safe. The safety profile and the way it functions through almost none of it reaches the liver. And so it means it doesn't last very long as an anesthesia, but it still helps reset the nervous system. So the fight or flight versus rest and digest, which can be dysregulated due to trauma, due to stress, due to surgery, due to pain, due to infection and inflammation, like you were talking about in the beginning. And so I feel like in all of my education for chronic disease, longevity, integrative, whatever, it's one of the only things that really targets the nervous system and the way the body communicates, which could be nerves themselves. And so if we leave out this component, right, we can look at vitamins and minerals and peptides and triglycerides and sugars and all the things, even muscles and bones and organs and tissues. But if we leave out the nervous system, then we won't be able to get people as well as we otherwise could, right? We're missing a link there. So it is anesthesia, but it doesn't work very long that way. You do feel a little disconnected or disassociated with it. That's the nervous system resetting. And I really I really have been able to, I don't know, I focus on Anna Aslan. She was a Romanian scientist, physician years ago. There's been others that play with this, the Heineke brothers out of Germany, who over the course of over a century now have really been able to hone in on the benefits. And a lot of those are multifaceted and things that go beyond anesthesia.
Yeah, so I always try to simplify things. It's part of my nature to try to get the 30,000-foot view on things. And one of the things that comes to mind, it's one thing to worry about a toxic load, whether it's EMF or you got heavy metals in your system or you have an infection or you've mounted, you have a gut problem that's causing a lot of inflammation. And then there's the side where mitochondrial function becomes very important in dampening these things and even recovering from these things. Do you think Procaine sort of fits on one side or the other, or is it a completely separate avenue in terms of how you're taking care of people with chronic illnesses and chronic autoimmune conditions?
No, because I think it goes right alongside of it. Because again, there's this mechanism of communication, sodium, potassium. This isn't the simplified version. I'll leave that to you. But on the sodium potassium pump that works inside each cell that creates the neuronal communication. And that is connected to mitochondria. That is connected to how cells cycle, how they live, how they die, how they communicate information from one cell to the next, and also from cells to tissues and organs and so on. So I use it to simplify sometimes with patients. I'll say, it's just like the electrical situation in your home or your car, your office, right? If you have I feel like the spine is kind of the connection of your body to the function, to the cells, to the organs. And you can have those extension cords plugged into the wrong outlet and the power is not going to turn on, even if the device is functional, right? You've got it, or if there's no power going to that outlet, you could plug it in all you want. It's not going to work. It's not going to communicate. You're not going to light things up. And so the body can work like that too. And again, there's things that cause those connections to misalign and to not be connecting the power all the way down to the mitochondria for the ATP and so on and so forth.
Right. Anesthesia, one of the ways that it works is it changes the way sodium and potassium are traveling across the membranes of cells, temporarily disrupting that. And that's part of why it sort of disrupts the feeling of something happening here. That's the anesthetic impact. But what's happening with Procaine is it's happening on a short-term basis. It's breaking down into this anti-inflammatory compounds that have a lot of benefits in your body. And it's literally a reboot of the electrical function of your cells. It's literally a reboot. It's really impressive, and it has some interesting effects on the way people are feeling this reboot. So that was one of the things that really impressed me with some of these plexus injections that you guys do. But Christina, maybe you could tell me, what kind of a patient do you usually treat that benefits from Procaine? Like when you see somebody, what is it that triggers you to say, Procaine would probably work for this kind of a problem?
That's a really good question. And one of the sayings that we have is when in doubt, Procaine it out. So when I am talking with somebody, and whether it's something super simple or something really complicated, it can be as little as they seem to be under a whole lot of stress or they are recently getting a new diagnosis. I will think of it as an original treatment to say, why don't you come in? Let me tell you a little bit about how Procaine works. Our nervous system is really one of the most important things when it comes to how our body is responding, which is what we're talking about. And so if you're constantly in fight or flight, if you just experienced a trauma or you have a history of trauma, if you have anything chronic pain, chronic illnesses, if you just aren't seeming to be progressing in your treatment with either mainstream medicine or even functional medicine, if something just seems stuck, I always think to Procaine, because we always think about, okay, well, that autonomic nervous system, that sympathetic fight or flight, that parasympathetic rest and digest, so many people are stuck in fight or flight. And so really, I have really incorporated Procaine with just about everybody I can think of. Now, not everybody takes that and does anything with it, but on a daily basis, I think of people and I just at least offer them, would you at least like to come in and try it? It really gives your body an ability to just reboot like we've been talking about. It's really magical, and until you experience it or see your patients experience it, it's hard to explain. but just allowing them to feel that, like Kim said, little bit of disconnect or little bit of just letting those emotions flood out. So many people are candidates for Procaine, really almost just about everybody, unless you have an allergy to Procaine, very few cardiovascular things, but really everybody.
Listen, if anything, it seems to me there's a lot of cardiovascular benefit, but I experienced the IV Procaine myself, and I fully wanted to get the biggest dose I could possibly get as fast as possible just to see what it would do to me. And it was rather interesting. It's very relaxing. It almost felt like I got a truth serum. I started becoming a little blabby while I was getting the infusion, and it felt like a nice high, and I was completely relaxed for at least 24 to 48 hours after that. It was pretty impressive what it's capable of doing. But maybe all of you, Kim, maybe you can come online too. So you're talking about trauma, right? So if you have, let's say, post-traumatic stress disorder, one of the biggest things people are running around to do is ketamine therapy, and it can be very helpful. I've seen people get a lot of great benefits out of it, but Procaine seems a little simpler. Is it something you could use for post-traumatic stress disorder?
Yeah, absolutely. Works really, really well that way. That's exactly why you would use it. And it
What
is
have you
safer
guys
than
noticed?
ketamine.
So many things. One of the things that is a little bit harder to find actual studies on, mainly because in the United States, they have gone more towards using longer acting anesthetics that don't have any of the same properties that Procaine has, or to things like ketamine, but is so much simpler, is in and out of the system in 20 minutes. And you don't relive the trauma. It just flies away like little butterflies. It's so interesting, but people will just say, I feel lighter. Or, one of the things that Kim taught me about early on is some people will have a little bit more of an flutter in their chest, or even get anxiety. And when you explain to them that it's okay to feel that, and that is just those emotions leaving their body, they do really, really well with it. And you had a great example of what can kind of happen when somebody actually gets one of the injections and maybe has what somebody might think of as a negative response, but just a really strong emotional release, and that's okay for that to happen. But we see on it, I mean, that's one of the biggest reasons that we have people do it, is so that they can experience just that relaxation, and that sometimes they start crying. Sometimes they don't even know why it's happening. So I'm sure Kim sees that on a daily basis down in the IV room.
Yeah, it's interesting. I always say everybody's different and everything's normal. And there's lots of different types of emotions. So realize that emotion doesn't mean crying all the time. It can mean frustration. It can mean stress. It can mean sadness. It can be loneliness. It can be all sorts of emotion, but you want it to flow out. Ultimately, I always say too, like, you feel like, you can hear me, you can see me, you know what's going on. You just don't care as much. So those triggers, whether they be true like PTSD, really traumatic things, or whether it just be the everyday stress in our lives. This is where I also feel, along with what Christina said, everybody is a candidate, because everybody is overstimulated. Everybody is overworked. Everybody is feeling like life is moving so fast and that they're trying to keep up. Everybody's got instant access to their emails and their phones and their texts, and everybody's got instant access to us. And so most of us are in a higher sense of fight or flight on a regular basis. So to just feel and be able to regulate that, so that the little things in life don't trigger us, because it should be preserved for the big things, right? Fight or flight is a mechanism that's for safety and it's for function, but it should be preserved for the bigger scares and traumas in life versus driving down the freeway at 5 p.m. So I think it's even could be something that could be used on a regular basis, just regular stress relief. Does meditation work better or as well? Yes. Is ketamine something that could be done for those big traumatic things? Yes. But this does have a higher safety profile. It's less expensive. It's easier to receive, and ultimately you just feel lighter and happier when you have it. Like it's just sometimes it's subtle even like that, and sometimes it's pretty emphatic.
Yeah, and I think the other thing to remember is that when people are suffering from chronic conditions and they've gone through the steps of they've seen multiple doctors and no one's doing anything except focusing on one symptom that they're trying to treat with a particular drug as opposed to what's the underlying issue. And the fight or flight gets stimulated even more. I mean, the frustration that's involved, let alone that their body is constantly trying to overcome this inflammation and the amount of adrenal stress that can create. You have something here that could sort of mellow things down. And we even met patients at your practice who had a lot of reason to be stressed, a lot of injuries. And when they got on this, it changed their life. And it's almost like they have to come back regularly because they feel that good. And they're coming in constantly to get the therapies. And that was very impressive to get that as a testimonial. I mean, this was not a simple story on this patient. And she swears by this therapy. And so do a lot of the other people that were in your practice. So it was really great to see that. The other thing that really impresses me is, yeah, go ahead.
I just want to say one thing to that, because the question then begs itself, is it addictive? Mm-hmm. Is that, because I want to feel good, because I want to be here, because it helps me so much, is it addictive? And it does not have addictive properties. That said, we're always continually potentially being stressed and being, asked a lot of. And so, a regular maintenance, I feel like as human beings, we are in need of regular maintenance, and our nervous system is part of that. And so it's hard sometimes to breathe deep and to meditate and do things that might offload that. And so, coming in, especially if you're going through those periods of time where something might be going on that is stressful, then we can help our nervous system by doing this type of thing. But it is not addictive as a chemical itself.
Yeah, and I think we need to clarify for people that an addiction is a behavior that leads to a negative impact on your life. These people are not having a negative impact on their life. They're having such a wonderful reaction. They're back to normal. They're exercising. They're socializing. They feel really good. And we're not talking about a high good. We're talking they just feel like they're back to normal. And that's not an addictive thing. Now, food can be addictive, right? When you do too much of it, you gain weight, you get unhealthy. But food is something that you need in order to feel good. So we're always seeking out things to make us feel better, but still allow us to operate in our life. And that's not an addiction. That's just a necessary thing to keep your body going at its best. So I definitely don't think of it as an addiction at all if people are seeking out something that helps them that much. So the big ones, I got to tell you, the plexus injections that you guys are talking about, which I've had an opportunity to do quite a few lately. It's been a lot of fun. But we're talking about the most difficult conditions for people to manage, from fibromyalgia to inflammatory bowel disease, to having postherpetic neuralgia, from shingles, from having chronic headaches, migraines, to having pelvic floor discomfort, which we have a big population that we're trying to help in the New York office, where people who have endometriosis, people who've had polycystic ovarian syndrome, people who just have discomfort urinating, anything like that. All these things can be helped with these plexus injections. And I don't know if you could talk about that a little bit more, Christina. Can you tell us a little bit about those plexus injections and what's involved?
So essentially what we do with Procaine when we are injecting it is we can do it in scars. So scars hold energy. So we do a lot with scar therapy. We can do where we do what's called surround the dragon. So if you have an area that's hurting, we do little tiny blebs around that area. But what Dr. Gio is talking about is the plexus injections. So there are various different areas within the body where we have nerve endings and ganglion that innervate different areas. So one of the biggest ones that we do with Procaine therapy is called the stellate ganglion infusion. And that is located in the neck. You can actually see this big muscle, your sternocleidomastoid. And right behind that, you can feel C6. And right there is the stellate ganglion. That is innervating anything from the top of the stomach to the top of the head. So you're talking migraines, vision problems, facial issues, sinusitis, dizziness, vertigo, heart issues, reflux, autoimmune, thyroiditis, literally anything from the top of the stomach to the top of the head, you can work on that stellate ganglion infusion. It's very safe. It doesn't hurt the patients at all. And it gives this beautiful reboot of that autonomic nervous system. And people just feel lovely. This is a huge one for PTSD, for anxiety. This is one that we do on a weekly basis for PTSD. There's lots of studies, especially done within the veterans And I have cases where I've had patients come in on a weekly basis for anywhere from 12 to 15 weeks for PTSD. And it is life-changing. People that have had done everything else. They've done ketamine, they've done psilocybin, they've done all the medications, they've done all the therapy. And I have a specific gentleman that is now back to work. He's a nurse. He's able to be back on the floor. I mean, it's just huge. The one in the stomach works on the vagus nerve, so it's called the celiac ganglion. So the ganglion is like this little, almost like a tree root that goes down at the base of that nerve and gets that whole plexus. So the one in the stomach called the celiac, super simple. People don't feel it at all, but it reboots the whole vagus nerve. And that vagus nerve is in charge of so much, especially when it comes to like anxiety and depression, any gut issues, diarrhea, constipation, ulcerative colitis. Anything that you can think of within the gut area, it is a simple, like, takes less than a minute and reboots that whole vagus nerve. The inferior hypogastric, or what's called the Frankenhauser, that's a big one that Dr. Gio was talking about in regards to anything within the pelvic area, whether it be benign prostatic hypertrophy, any sort of prostate issues, any pelvic issues, any uterine issues, irregular periods, PMDD, PCOS, anything within that pelvic area. 2 simple injections and that whole area is just rebooted. We've got one in the facial area called this sphenopalatine ganglion. So it's actually an injection goes here. We're aiming here. And that one takes care of like trigeminal neuralgia, migraines, anything around the eye, facial pain. They're brilliant injections. So there's
And
lots
some of the
of those
most
different
difficult conditions too. We're talking about difficult
Yes,
conditions that people don't have a lot of answers for, and you're actually providing relief to the patient. That's why I find it so powerful.
absolutely.
And even with the pelvic
It
floor
is.
one, I get excited about that one. I'll tell you why, because I used to do it mainly with ozone only, but with the Procaine on top of it, it's actually very impressive. So wonderful techniques. So yeah, we talk. Can you tell us a little bit about the crown of thorns? What's the crown of thorns?
Well, let's bring Kim on for this one because she's the
Okay, good.
queen of crown of thorns.
And the
Yes.
neural reset. I want to hear about the crown of thorns and the neural reset that you do with the back
Yeah, neural therapy's been around a long time, and so Christina's had more of the more recent training, and then mine's a little bit older, where we did the crown of thorns, which is also kind of everything in the head. It's it could be headaches, it could be memory, it could be cognition, it could be brain fog, and that's the way I was taught. It was just anything neck up. And it's resetting that localized point there, but it literally looks like a crown of thorns, Christ on the cross type thing. And they're just these little tiny, super superficial injections around the crown, back behind the ears, and down the middle of the scalp. But again, it just resets the way that the head and everything, eyes, ears, nose, smell, the way it functions and communicates. And so it's just kind of a localized injection that's fascinating. And then the total body neural reset is basically focusing at the spine level. So every nerve we have comes off the spine and goes to where, communicates and connects to organs and tissues and so forth. And so if you reset at the spine and go every facet, then you can reset function, and the sky's the limit. But the goal would be to do the whole body at once. So IV does the whole body at once, but from a blood level and systemic. But then you can also target the spine with, again, multitudes of different functions coming off the spine.
So if a patient is coming in and wants to undergo Procaine therapy, is there some sort of a stepwise approach you have in terms of increasing the dose? Is there a reason why you have to start low, go slow, or do you just go automatically to the highest dose?
There's, whether we're talking injections or IVs, there's still a method to introducing the patient to a small dose, sometimes based on body weight, sometimes based on their situation. Some practitioners might check for pH and other things, but I think in the IV space, practically for the patients or public that might be listening, it's how are you going to feel? You want to introduce it because not everybody is comfortable with this disassociated feeling. And, you can be warm and tingly, you can be sweaty, you can, that emotional release. And so just kind of introducing it at a moderate pace makes the most sense. Medically, there is a minimum and a maximum dose that we feel comfortable with. And, we talked about this when you came here, is the American way is more is better, or go big or go home, these phrases that say if a little bit's good, a lot is better. And this research actually shows that that's not true with Procaine. So while some people reach their max dose and they love it and they give me more, we cap it out because there's a safety component to it and a point of no return, so to speak.
And so is there a rationale behind, because I know that sometimes bicarb or bicarbonate is used in conjunction with Procaine. Why is there an introduction of Procaine sometimes without bicarb, and what's the rationale behind using bicarb?
Yeah, like all of medicine and science, there's just different realms of study and different studies that have been done to see what can be the most effective. Like I was saying, different than Christina's training, mine goes back a lot further and kind of more old school, where originally we didn't use any sodium bicarb and it works really good. But the sodium bicarb has been shown to increase blood serum levels. And so if you're trying to get that intracellular component, right, the sodium potassium pump infusion into cells, then the sodium bicarb can help that to where it can have a greater effect with less Procaine. And that has a safety profile too. And then they added to injections because it can kind of take the sting away. It just kind of neutralizes the sting of an injection. But depending on where the practitioner got trained and depending on which country their training came from. I had a lot of European training and a lot of Asian training. And so we didn't use sodium bicarb to begin with, but I've been using it since being with Christina. And I do think many, many patients see a benefit when used with the sodium bicarb.
From both of you, maybe from both your experiences, is there, since in the integrative realm, we do tend to do a few things, including nutritional IVs or even supplemental IVs. Is there something that you can give with Procaine that will optimize what you're getting out of it from a vitamin infusion perspective, from any other kind of therapy, from ozone therapy, from anything like that?
I would say it's almost the opposite, that Procaine can enhance so many other things versus something enhancing Procaine. I did a lot of integrative oncology, and in that world, I was taught a lot about, like you mentioned, just chronic disease and diagnosis can create this irreverence in the nervous system. So, especially in the cases of being diagnosed with some late stage diseases, we would put just a couple cc's in their Myers cocktails and, just help people feel more relaxed, help their nervous system. But even though there are also some antiviral and cancer properties to it as well, but it really does kind of enhance other things. You can put it in almost anything and you can do it by itself also. And it does go really well with ozone. If you're doing any ozone IVs of any kind, that creates lots of circulation and vasodilation. It helps the cells be more available, let's say. And so then when you give the Procaine and kind of piggyback to that, you can get some added benefit.
Understood. So the whole concept of interference fields, and I imagine that scars are an example of an interference field, but how important is it to treat scars? I mean, in my practice, we've dealt with scars by injecting them with ozone. We've had people that don't like the way their scars look, and we'll even give them exosomes and make them disappear. But it turns out Procaine does some pretty interesting things. So how important is it to treat scars?
Well, again, going back to my training, they would say it's imperative that you can't ignore that portion of a patient's history, and that everybody's first scar is their belly button. So scars, when you talk about interference fields, whether it be the trauma itself, like a surgery or being born, or just an injury that creates a scarred tissue, it's an interference field, both emotionally and physically. So that scarred tissue, and the fact that the scar could actually, a scar means that at some point something was dissected, let's say, or intersected. And so, it's been cut. And that ultimately altered the communication pathways and networking, this whole electrical system in our bodies, and maybe even in one location and maybe the whole body, but it's disrupted it. And even though the surgeon may put those things back together or it heals on its own, it doesn't mean that the body naturally communicates. And that one of the one of the examples of this is like phantom limb syndrome, where, somebody gets a finger cut off, let's say, and the finger's not there, but there's still pain, and the brain is still sending these signals. So a scar or any type of surgery can be the same thing, where the body's still sending these pain signals of an injury or amputation, even to that point. Knee replacements and all these other types of surgeries are very similar in theory. And it creates this interference field or blocked ability of the body to communicate, and that could be towards function, like if a knee function or shoulder function. You had an interesting response with that yourself, and yeah, all the way through to the aesthetics of the scar. But ultimately, those scars do create imbalances, and they do create interferences of the body to communicate and share energy. And the function can also be ultimately affected. And so, if we don't address the scar itself, not just the cells, not just the joint, not just the tissue, but the scar itself, then we can't release that and allow it to restore the way it was designed.
And so internal scars are a little bit more difficult to handle. And I'll tell you from a cardiac perspective, when somebody's had a myocardial infarction, or if they've had myocarditis and they've created an internal scar that you can only identify on an MRI or on an echocardiogram, when somebody's had a heart attack and there's a piece of the muscle that's just not moving, that does not conduct electricity in a normal manner. And that's why people who have those conditions have electrical arrhythmias, ones that can be deadly and ones that require a defibrillator. So, when we were talking about the stellate ganglion injection, I think that's definitely, and remember, your heart pretty much relies on C3, C4, C5. So whatever keeps the diaphragm alive is also impacting how the heart's functioning. So when you're doing reset therapies with the stellate ganglion, you're also impacting the parasympathetic tone of the heart, which is a very important piece of treating people who have had heart attacks and heart failure. In fact, they even have a special kind of pacemaker now for heart failure patients. It's a very deadly disease. They call it cancer of the heart, but they actually have one now where it'll stimulate the carotid body so that you increase parasympathetic tone, and it's been shown to actually improve squeezing function of the heart. And they're trying to move it up in the sequence of things that you do to help people who have an ischemic cardiomyopathy. So now we have an intravenous therapy that could do very similar things. And you even have a stellate ganglion injection that could do very similar things. But those internal scars cause problems just like the external ones can. And so to me, it's fascinating that something down here can cause a problem down here. This whole concept of interference fields. And I think historically, I always found it fascinating how they first figured out something was going on with Procaine when they treated a scar here and it made something that was a chronic problem go away. It's almost like you need to have electronic harmony all over your body. And if you can't establish that communication all over the body, something is off. Makes you...
Oh, I love the way you say that, electronic harmony. That's a really good phrase for it. And I love that you bring up the fact of electrical balance in the heart, because the brain is powered by energy. The heart is, I think, about 35% electrical along with everything else. And I think as human beings, we inherently know it, but we don't think about it that way. And so again, if it's not powered correctly, and there's these interference fields, then it's just not going to work well. And just to throw this in there, the stellate ganglion injection, I think, also just targets the head, but that's also that total reset. If we do those C vertebrae, then it's going to control just like what you're talking about.
Right. Really interesting. Christina, do you take care of any cardiac patients that you've given the stellate ganglion shot to? Did you ever get any feedback from them about that?
Specifically that I can think off of that I'm just working on cardiac. I mean, I know a lot of my patients do have cardiac. Actually, come to think of it, I did have a gentleman just recently come to see us that was having an arrhythmia, a heart palpitation, and wasn't sure, was it anxiety? Was it something different? He had had a full cardiac workup and nobody had come up with anything other than he did have a little slight arrhythmia, but they weren't able to pinpoint where it was coming from. It was not an electrical issue that they could see within his heart. It wasn't obstructive sleep apnea. So I think it was actually him that suggested that he come to see me. And so we started doing his stellate and his celiac and also reset his cervical spine. And then he actually had some issues on his lower back. And The first treatment, he noticed that the heart palpitations stayed away for several days. The second treatment, he noticed not as much. The third treatment, and these are treatments a week apart, he noticed that he got about a week. And then that fourth treatment, he did notice that for the most part, those heart palpitations had gone away. And so do we know whether it was affecting it electrically or whether it was anxiety? We don't know for sure, but that's the nice thing about trying some of these things that are outside of mainstream medicine, is we didn't have to add a medication. We didn't have to do anything, overly major, aside from it really is pretty major when you can reboot the autonomic nervous system and see those symptoms go away. So that would be a good example, I guess, of a cardiac patient that I've dealt with.
Yeah, and I think the whole concept of trying to boost your parasympathetic activity or balance it out with your with the typical autonomic activity. We have people who suffer from anxiety. They go on antidepressants. They go on anti-anxiety medications, and I find many of them come here and they want to get off of these medications. And they've even tried in the past where they'll stop cold turkey, which is not a good idea, or they'll even stop slowly and they just can't get past it. So in my experience, when you're able to balance, especially in women who are postmenopausal, when you're able to introduce some progesterone into the system, that can really do a good job. The other thing is I found that methylene blue can do some really good jobs in terms of improving anxiety symptoms and overall mood, and lifting brain fog. I guess what I'm trying to figure out is we had a story of a patient that you guys were seeing who was, I think, on antidepressant therapy and was able to back off of that therapy because she just felt that much better and calm. Is that a common experience that you guys have with your patients?
Do see that a lot because we
Mhm.
are, as all the other, functional medicine providers out there, integrative medicine, we're looking at the whole picture. So we're looking at sleep, we're looking at nutrition, we're looking at exercise, and we're looking at some of these ulterior, alternative things that we can do. We're maximizing vitamin D levels. We may be doing some methylene blue IVs or doing oral methylene blue from a compounded pharmacy that's safe. Tiny things, but absolutely when we can address that deep down stuck emotion, and that's what happens to so many people that have anxiety and depression, is it's not something that can be treated with an antidepressant. That's a band-aid. Getting to the root cause of why is it happening and help them to release those emotions in many different ways, whether it be that they're going to counseling, whether it be that they're going to an energy healer, and whether we can idealize and utilize Procaine to just let those emotions out, let them talk about things. Have an amazing example of how well Procaine works. And we found this by accident. I had a lady that I was doing actually an aesthetic procedure on that was a fairly painful aesthetic procedure. And her body just kind of went into shutdown. And I said, okay, we're going to stop this right now. I'm going to have you come back and we're actually going to do a Procaine IV. We're going to start it prior to the procedure. So the next time she came in, we started the Procaine. We did the procedure. It went so much better. She felt amazing. She didn't have any of the, extra, her body just kind of going into that fight or flight. But the magical thing was she actually called me and about a week later, and she said, Christina, I don't know how much I can thank you. She said, I myself am an energy healer, and I've been doing everything possible for myself. I've done all the red light, I've done all the rebalancing, I've done all the Reiki, I've done all the breathing supplements, I've done everything that I can think of. And I have not been able to get over this emotional trauma that I haven't even been able to talk about. She had a son that overdosed 2 years prior, and she had not cried for 2 years. And it was really affecting her because she was just so upset. How do you not be able to cry over losing your own son? And her family wasn't allowed to talk about it. It was like, you're not allowed to talk about it. After that first dose of Procaine, she said she cried for an entire week, which some people would take as a negative sign, but she was elated that for the first time in 2 years, those emotions released, and she was finally able to heal that. So she kept getting Procaine every week. I think she did it consistently for around 6 to 8 weeks, and now she's just able to get her maintenance doses And a lot of people ask about that. Well, how long do I have to do it? How many treatments do I have to have? When do I know if I need more? And it's very individualized. But generally speaking, we'll start off with a minimum of 4 and we'll say sometimes 8. And then you get to determine what that maintenance phase looks like. But absolutely, we can get patients either off medications, or maybe it's that they're on medications, but they've been refractory to them. They're just not working as well. One of my PTSD patients that I was talking about was on every medication under the sun, had tried literally everything, and just had the most refractory, horrible, debilitating depression, to the point where some days he just couldn't even get out of, he would go in his closet and he would sit in his closet and was just suicidal. And he just did not want to be around anymore. But he has a family and kids, and he is the gentleman that I spoke about that is now actually able to be a charge nurse again. He's at the hospital. He's interacting with people. And that's just...
Yeah, listen, I think neural rebalancing is, I got in my field in cardiology, I deal with this with 50% of the patients, especially the younger they are, the more you'll see it. So usually a lot of young women will come in complaining of palpitations. And, in the back of our minds, we have that list of things that we've been taught to use. So I try to do a little bit more integrative. So I'll introduce magnesium in those kinds of situations. If they're having sleep problems, we'll use magnesium threonate. We'll introduce L-theanine. We'll introduce ashwagandha. And now with POTS, we're doing similar things, but we're using beta blockers. And what are we doing? We're trying to dampen the sympathetic overdrive that's driving this stuff, which, if you really think about it, it's actually parasympathetic deficit, right? So, and then you're also looking at the thyroid, right? You're trying to find out, is the thyroid overactive, because that drives the adrenaline in your system and can cause the palpitations. Again, it's all about neural rebalancing. And whether you're doing a Procaine injection or an intravenous Procaine, you're rebalancing the nervous system so that the sympathetics and the parasympathetics are sort of balanced out. And I think this is a very important and non-toxic, easy therapy. And it's got so many uses. Honestly, I'm going to be promoting it pretty tremendously because I think it's very useful and easy to do. And I want to thank both of you really for giving me my in-depth look into Procaine. I really appreciate it. And I hope to give you good reports as time goes on. But Procaine therapy is definitely an important weapon in our tool chest. Thank you so much. Guys, you are, why don't you say a little bit about your practice? Where are you right now?
So we are Ridgeline Longevity Anesthetics. We are in Idaho Falls, Idaho. And I'm going to let Kim talk a little bit about herself also, and also for any other providers that are out there listening, or any other offices that want to get training just like Dr. Gio did. Kim has an entire training program.
Yeah, thanks, you guys. It's been my privilege to work in Idaho Falls again. I've been training for the last 10 years all over the world. And so it was nice to be able to say, hey, local, for my friends and family and the people I care about the most, to have a place to go. And so we are here in Idaho Falls, Idaho, and we do also do the trainings about once a month. Christy and I bringing in 5-6 practitioners. So even if you have a favorite practitioner that you think would be into this, right? You're already doing some integrative things and you think maybe they'd be into neural therapy or Procaine IVs, you can send them our way. So I actually own a company called Ozone Training Academy. You can go to ozonetraining.com and you can see that. And we utilize lots of the IVs along with ozone and ultraviolet blood irradiation, but we do teach neurotherapy too. So we're happy to have any providers who want to learn more about this. And if you're one of the general public and you think this is something that you would like to try, then of course you can find us, and we have a list of providers that we can refer to as well.
And what's the website? What's the best way for them to reach you?
Ozonetraining.com is where we also house the educational, the way to purchase the tickets to come to the training. Our website is ridgelineaesthetics.com if you're a patient and would like to come to Idaho, or you're close to Idaho for that treatment. And you can reach me at kimlook@ozonetraining.com.
Great. Okay. I think this was wonderful. I really appreciate your time. It's been a long day for all of us, but I got to tell you, it always turbocharges me to talk about exciting stuff that's out there that works. And that's why I don't need so much sleep when I talk about these things. So thank you. again
You
for
know, you should share that. You should share that. Like you said, you slept like so great after having the Procaine. And Christina's a sleep expert. This is a whole nother topic. Like, you know, the ways that we can balance our nervous system and rest and repair only happens when we sleep well. And Procaine helps you sleep.
Yes.
All right, guys.